Good morning, and welcome to the North Simcoe Muskoka Specialized Geriatric Services COVID-19 Practice Short Series. Please note that invitations to this practice short have been extended not only to the SGS team, but to our system partners, and we welcome everyone today. I'd like to once again point out some Zoom features. On the bottom left of your screen, you will find a mute button, and we ask that you remain muted throughout the presentation. There's also a video button to its right, and it's a feature that it's absolutely up to the individual, but a suggestion would be that maybe you have your video off as well. The chat box is at the bottom center of your screen, which is available for any questions you may have for today's presenter. There may be points during this presentation where we will ask you to type into the chat box, so I ask you to familiarize yourself with this feature. Today's session is being recorded and will be accessible on the SGS website under the Education tab under Monthly Education. For those of you who have missed the previous Practice Short Education sessions, you will find their recordings there as well. If you prefer not to be on the recording, as I said, please use the chat box for any questions. Next slide, please. This visual shows the health footprint of a pandemic and acknowledges the impact of that the pandemic will have. You may recognize this visual from the discussion paper released by SGS in May, entitled "The Need for a Multidimensional Strategy to Address the Care of Older Adults and Their Caregivers in COVID-19. This is also available on the SGS website. We've chosen this visual to be used as a framework for our practice short sessions. Each month, we will focus on one of the waves, finishing up with the work that the NSM SGS has done and continues to do throughout the pandemic. The practice shorts will occur on selected Friday mornings at 8:30. They will range from 30 to 40 minutes. And as I had mentioned, the recordings will be available for future reference. Today, we are focusing on the fourth wave or dimension of the pandemic: psychological trauma, mental illness, economic injury, and burnout. As much has been learned to date. Before we pass this over to our presenter today, I don't know if any of the SGS leadership have any announcements or any system updates that they would like to share with the group.
Sorry, it's Annalie.
Hi, Annalie.
I just popped on, so my apologies. I didn't realize the time, so I don't have anything specific right at the moment. But I'm not sure if anybody else is on. I haven't even had a chance to look to see who's on, so my apologies.
It's Sylvie here. I'm on, and I apologize. I don't have my camera on. No, I don't have any updates right now. Thanks, Allison.
Wonderful. Well, without further ado, I'm going to pass it over to my colleague, Kim Simpson, Psychogeriatric Resource Consultant for the Barrie and South Simcoe area. Take it away, Kim.
Thank you, Allison. And so just before we start, and as Allison had said, today we're really going to focus on that psychological trauma and burnout, that fourth wave. And before we get started, what we were going to do is just launch a couple of polls. And so I'm going to ask Allison to launch those polls for us. There are 3 questions, and I want to assure everybody that these are anonymous. But the 3 questions being, since March 2020, I would say that I have experienced more stress than usual. Question 2, I use strategies to manage stress. And the 3rd question, I know of resources I can access to help me manage my stress. And so I would ask people to fill in the poll. So just click on your answers. Reminder to scroll down. There are 3 questions there. And again, it's anonymous, just so we can get a bit of a baseline as we get started. So we have 65 people, or 65% of individuals who have voted. We're going to get up to about 75 if we can. And I'll ask Allison to end that polling. and to share the results. And so just so everybody can have a good look there, most people would say 88% definitely yes, they've experienced more stress. 90% definitely experiencing stress since March 2020. Using strategies to manage their stress. Somewhat yes was the most popular, and some people are saying not really. And I know of resources that I can able to access to manage my stress. And most people do, but some people are neutral or not really. So thank you for that opportunity. So I think what's really important is the PRCs, all of us are compassion fatigue trainers. And so we have been providing some emotional support and pulling some of this literature and sharing it with teams as we've been moving through COVID-19. For the sake of today, our objectives of this presentation is really to increase the awareness of the psychological impact of pandemics and talk specifically about COVID-19. To discuss the impact on healthcare workers, so many of us who have joined today, and to discuss practical strategies to manage stress, and then hopefully to share a bit of resource sharing at the end so that you can walk away with some resources. I think it's really important to know that I have pulled a lot of literature to help to inform this presentation, but it is not an exhaustive literature search. As you can imagine, there is a lot of evidence out there, and evidence keeps coming to the forefront. And normally when we're talking about recency of articles, if we have something that's within the last couple of years, we're quite recent, but things are evolving on a daily basis. I do think that the information that's been pulled is a good overview for today's presentation. As we start talking about today, I haven't defined specifically compassion fatigue, burnout, vicarious trauma, and stress. Overall, we're going to talk about that chronic stress over time that we've been experiencing, and we're going to talk about stress and mental health in a general sense, and it's the stress and how it impacts mental health. I think a good starting place is to just talk about COVID-19 and to recognize that we have been dealing with this for less than a year. In fact, it wasn't until December 31st, 2019, that China informed the World Health Organization of a cluster of mysterious pneumonia cases. And then in January 12th of this year, the World Health Organization recognized the genetic sequence of the virus. In regards to some Canadian stats, the first case of COVID-19 was detected and reported on January 25th in 2020. And really, it's only been just over 8 months since the World Health Organization has announced a pandemic. For all of us, this is new for us if you're under 100 years old. And so we all have been working to work through this together. The literature has called COVID-19 a gero pandemic, because initially believing that it impacted mostly older adults. And what this has done is it has really accentuated ageism in our society. Ageism, which is a coin that was termed in 1969, is a process of systemic stereotyping and discrimination against people because they're old. And it can be expressed, fostered, and perpetrated by the media, by public policies in the workplace, and by casual daily interactions. And I think it's important to know that there can be individual ageism, so the thoughts that we hold, but there can also be institutional or structural ageism that may be seen in expressed in legislation and mass media. I wanted to bring this to this group because I think it's really important that we recognize this. I think many of us have talked about the ageism that we've seen in the media and with some of the practices that have been happening and having conversations with individuals in the community. And as healthcare providers who are working with older adults, I think we have a role to play in breaking down this discrimination and advocating for older adults. When we talk about just mental health during pandemics in general, mental health impacts can be quite significant. During epidemics, the number of people whose mental health is impacted is often greater than the number of people infected with the virus or the infection. And the impact of mental health implications can last longer and be more prevalent than the epidemic itself. We know that groups that are more vulnerable to psychosocial problems include people who are at heightened risk. Those people include the elderly, individuals with compromised immune systems, and people who are living or receiving care in congregate settings. So many of the clients that you are supporting. Healthcare workers are also at higher risk, and people with pre-existing medical, psychiatric, or substance use problems. So if you were treating people with any of these conditions prior to the pandemic, they're at heightened risk to experience mental health or psychosocial problems. In addition, women are at higher risk, and individuals with lower education and lower income are more likely to suffer depression and anxiety. I think what's also important is that medical isolation can cause high levels of stress. And even the research shows that the impacts of psychosocial problems after the Boston Marathon bombings, when the city went into lockdown, that there was lasting effects of that. And we know that people are having to be isolated with COVID-19. So mental health, this is going to impact our mental health. Why we want to talk about this is that everybody's mental health is being impacted right now. And it's important to know this because chronic stress can impact our physical health. We know that that mental health and physical health are connected. I just want to take a moment to talk about supporting mental health of your clients, because as the PRCs have been doing case consults and working with teams throughout the pandemic, we've heard team members and clinicians highlight that individuals are seeing clients with increased mental health and stress, but also family members themselves. I think what's important to be mindful of is that the literature is highlighting that most people who are supporting individuals with COVID-19 may not have mental health as their expertise. And so we really need to bring together physical medicine and mental health. And so there's a need to provide education to healthcare leadership, first responders, and those individuals who are working at the direct care level with clients. Although mental health may not be your specialty, I think what's really important and what the literature highlights is that we need to screen for mental health problems. So not only do we need to look at the physical health of individuals, but we need to look at their mental health as well. Being able to provide psychoeducation is really important. And so that might be as simply as validating that having increased anxiety or worrying in a time of uncertainty is normal, but that if people are needing some help, making sure that we're getting help for them. Making sure that we are aware of what the psychosocial supports are that are available. With COVID-19, we know that supports have changed. They may look different than previous, but we also know that different supports may be able to present themselves. I think what's really important is that there is a suggestion in the literature that mental health support really needs to be provided even 6 months post pandemic or epidemic. And so that recognizing that people that we're supporting are going to need mental health support even after COVID we've got back to hopefully a new normal. Some of the literature suggests that COVID-19, we know it's an evolving situation, and that geriatric psychiatry really is going to need to take the onus on supporting and advocating for the mental health and well-being of older adults. We know that older adults have a different clinical presentation or an atypical clinical presentation to COVID-19, that there are clinical management considerations, especially for individuals with previous neurocognitive disorder and other psychiatric issues, and the idea of dealing with this social distancing or lockdowns of long-term care homes. Some of the evidence has suggested that there is worsening psychiatric symptoms in older adults in hospital settings related to isolation. So knowing that mental health is impacting everyone, and I know everybody here is really client-centered and focusing on their clients, but we wanted today really to focus on healthcare workers. The World Health Organization emphasized the extremely high burden on healthcare workers and called for action early on in March to address the immediate needs and measures needed to save lives and prevent a serious impact on the physical and mental health of healthcare workers. We know that healthcare workers themselves are more vulnerable to emotional distress. This is because of risk of exposure to COVID-19. So if individuals are supporting people who have been diagnosed with COVID-19, or even that there may be that risk of exposure, healthcare workers are often concerned about impacting their loved ones. And we saw a lot of that in the media in terms of people who were choosing to live separately from their family members. Shortages of personal protective equipment. And so early in the spring, when there was shortages and the worry of that can cause emotional distress in healthcare workers. Working longer hours, and being involved in emotionally and ethically fraught resource allocation decisions. So we saw in the spring, in Italy, them having to make decisions about, if we run out of ventilators, who gets to have the ventilator. And so all of that can contribute to emotional distress with healthcare workers. Other things that can impact are being a woman, and also just that being worried about your family members. Previous outbreaks and epidemics have shown that both frontline workers and non-frontline healthcare workers have an increased risk of infection and other adverse physical outcomes and mental health problems. And sometimes these mental health outcomes can occur up to years later after an epidemic, and they might include things like PTSD, post-traumatic stress disorder, burnout, depression, and anxiety. Why we need to worry about healthcare workers is we need to worry about our own health, but mental health problems in healthcare workers can affect our attention, our understanding, and our decision-making, which can really impact our capacity to hinder the fight against COVID-19. So today we're going to focus on that mental health piece. This is a figure that was pulled out, and I know it's a little bit blurry, but it's a visual taken by Mueller et al.'s paper, and it shows anxiety, depression, and insomnia in Chinese healthcare workers before, which is the light bar, and during the pandemic, and during is the black bar. What you'll notice in each of the condition is that there was an increase during the pandemic, but there is a larger increase or increased percentage in those who had moderate to severe anxiety, depression, or insomnia prior to the pandemic. So in line with that evidence that people at higher risk are those who had pre-existing psychiatric conditions. The prevalence of anxiety and depression and insomnia increased over time during the pandemic, and during the outbreak, 1 out of 4 healthcare workers reported at least mild anxiety, depression, or insomnia, so 25%. What we know is that people who are at high risk are also inexperienced healthcare workers. They often tend to have lower resiliency, less competency, and they tend to have less social support. Social support is actually a protective factor for these conditions. And so I think it's really important to be mindful of some of that as we think about bringing new roles into the healthcare sector. This is another visual, and it again is looking at the impact of healthcare workers in China. 44% having anxiety, 50% depression, and about 34% having insomnia. And I think the increased prevalence is important to be aware of because these are meaningful numbers. Even if you may not be experiencing some of these symptoms, it might be a coworker, it might be a team member. And so bringing awareness to the impact of COVID-19 on healthcare workers can help us to identify the concerns and address it. We really are in this together. As caring professionals, it's important that we look after one another. And despite the fact that research shows that healthcare professionals are less likely to seek out treatment for themselves. So although we might be at higher risk, we're less likely to seek out that help. Literature has shown that really healthcare workers tend to rely on family and informal social networks for support most often. If you have participated in our compassion fatigue training or some of the self-care work that the PRCs have been delivering since the beginning of the pandemic, you may be familiar with the warning system tool that we use. This is a similar tool. It's the mental health continuum model, and it was referenced by Colonel Helen Wright, who is the director of mental health for the Canadian Forces Health Services Group. And it was an article that she authored in March 20th of this year. And the article highlighted that it is normal to feel sad, worried, scared, and angry in uncertain times. But if you experience severe emotional distress, we really should be seeking help. You should seek help. I like this model because it is a continuum. And so you can move from healthy to reacting to injured or back to reacting. And maybe you might find yourself in ill. I think in March and right now, we still may be in yellow, but if we find ourselves creeping into orange or red, we should seek help. I like that it is objective and allows us to review and reflect on ourselves and perhaps those that we work with, some of the behaviors we might see. You might not correlate muscle tension and headaches with stress and psychological impact of COVID-19, but this allows us to stop and reflect on how we've been feeling. Increased anger and alcohol use may be indicative of orange, as well as poor work performance or being a workaholic. These are behaviors that we might not normally attribute to stress and poor mental health, but they may cause us to pass judgment or dismiss others, especially if we don't work in the mental health field and aren't attuned to recognizing these symptoms. So I really like this as a tool to reference. Another topic, and as I said, there's tons of information out there that the PRCs have been covering, is surge capacity and ambiguous loss. And to be honest, in September, it was the 6-month mark for me having to not be able to go out and support the teams in person. And I felt like I just hit a wall. I felt exhausted and fatigued, and I really had to, kind of dig deep to find my motivation. And we found this article that was published in August by Halle, and it talked about surge capacity. And surge capacity really is the collection of adaptive systems, both mental and physical, that humans draw on for short-term survival in acutely stressful situations, often natural disasters. And although natural disasters may have a long recovery time, it's often an acute time where we need to pull on that surge capacity, where you might need to deal with the tornado or the flood. But we know that a pandemic is different because a pandemic lasts over a long period of time. And so that acute piece can easily, that energy that we have of surge capacity can be depleted. The article itself was entitled Surge Capacity. Your surge capacity is depleted. That's why you feel so awful. And so when this surge capacity is depleted, we know that we can often feel exhausted, fatigue, and that is that chronic stress. And so what we have to do is find different ways of coping. We need to develop new coping strategies. In line with surge capacity really is ambiguous loss. And if you work in dementia care, you might have heard of ambiguous loss before, but it really does play a part in COVID-19 and the pandemic. Ambiguous loss is any loss that's unclear or lacks a resolution. It can be physical, such as a missing person or the loss of a limb and organ, but it can also be psychological, such as a family member having dementia or someone having a severe or serious addiction. But in the case of COVID-19 or the pandemic, it really is a loss of way of life. It's our ability to meet with friends, or it's the loss of having extended family celebrations, the loss of our freedom to move about, loss of rituals, and loss of things that we used to do. When we talk about the good old days when we can meet in person. I think what's really important is to recognize we're all experiencing these losses right now. And with these losses, we may be mourning some of those. So we may be finding ourselves moving through the stages of grief. So there's a lot of evidence out there to say why we need to focus on mental health and that the pandemic is impacting our mental health. And in different ways, not only our clients, ourselves, but our family members. And I hope that being aware of this it's really important, because if it is resonating with you, I hope it's validating that feeling that you're not alone. But I also think it's important as healthcare workers, because we need to look after ourselves and our teams. Research and evidence has also shown that there are practical strategies that can be used to mitigate some of these stresses. As I mentioned, nurses and healthcare providers relying on informal social support, relying on family members, and then taking behavioral strategies that can help to mitigate these stresses. I think what is evident and really important through the literature is that it does take a multifaceted approach. And what you will find is that there is, if you look in the literature, that there's a lot of overlap of what's being suggested. From a government perspective, government does have a role to play. And so government needs to ensure that there are adequate resources and infrastructure for mental health services. They need to ensure that clinical and mental health services are accessible to the population. And we've seen this as services have moved virtually, different programs have become available. Government has a responsibility to provide some psychoeducational materials that are easily accessible to the population. And we've seen this in regards to websites, social media, advertisement, public service announcement. They need to provide an official channel for updating information, and they need to be able to monitor and refute fake news. I don't want to become political, but I can say that I think Canada has done a better job than our neighbor to the south on this one. Government also has to really encourage that scientific research. We know that the situation is evolving, so we need to keep abreast of that. And they have a responsibility to collect epidemiological data that can support future and mental health policies. From an individual perspective, I think we can look after ourselves. That's the only behavior that we can control is our own behavior. It is, I don't think it's appropriate to think we can do it all ourselves, but we can make small changes to help manage our stress. Number one thing is to take care of yourself. As I said, research often shows that healthcare providers are not willing to get support and really don't take the time to look after themselves. If we can't look after ourselves, it doesn't allow us to look after the clients that we are supporting. I think what's really important is to make sure that we are following the health agency recommendations, that we're considering our own consumption of media and the impact of that, and then understanding that stress and fear are a normal part of facing an unknown, but also things like good sleep, nutrition, positive psychiatry, thinking about mindfulness and meditation. And we'll talk a little bit more about this in a bit. From a healthcare perspective, or hospital and healthcare centers, there's a role to be playing as well. And if you work in healthcare, you've likely been working towards developing contingency plans. It's really about how we're going to pivot to be able to provide support. It's important that healthcare centers provide and establish a trusting relationship and transparent relationship with their employees and ensure that there is adequate training and support for employees, ensuring that those that are at highest risk have appropriate psychological assistance and support, and that there is ensuring a healthy climate of communication. We know that the messaging is changing. The situation is evolving. So we need to be transparent and we need to keep those lines of communication open. But most importantly, we need to constantly value the work of those who are exposing themselves to the risk of the social good. And I think what's really important to be mindful of is that early on in the pandemic, people were banging their pots and recognizing healthcare providers. And we need to keep that up, because as talking and preparing this presentation with my colleagues, we were talking about that discourse that many healthcare providers are feeling right now in terms of we're taking these precautions, but we're watching the community do other things that really maybe aren't in line with what we're trying to achieve. I've included there a picture of the Covert Alert app, which is Canada's free exposure notification app. I think I recommend and I encourage everyone to download it. Some of the evidence for anxiety really is about taking action. So knowing that you can act and have some control helps to minimize people's anxiety. Being able to download that app, and if you're finding yourself having a lot of negative thoughts, looking towards the app can be helpful. It can either say, yep, you've been exposed, you need to go do something about it, or no, I have not been exposed, and help to stop those negative thoughts. As I said, I found lots of information and I pulled things that I thought might be applicable to the audience here today. Regardless of your role, I think what's important is that there's practical strategies you can take to look after your own mental health and also your team's. And so there's been a lot of discussion about psychological PPE. We talk about physical PPE in terms of masks, gowns, gloves, in terms of managing our physical health, but we also need to look at that psychological PPE. This is a visual that I really like that came from the Institute for Healthcare Improvement. And it was a blog, and really in it, they highlighted that heroes are not going to seek help. We need to bring it to them. And one way to do this is to incorporate psychological safety and peer support into daily practice without adding to staff workload. And so as you can see here, there's some recommendations from an individual perspective. It might be, making sure that you're avoiding media, taking the time to yourself or taking a day off, reframing negative experiences as a positive one so you can reclaim some of that agency. From a team leader perspective, it's really making sure that there are clear roles and responsibilities, that managers are aware of risk factors and are monitoring for distress in their staff, and to really kind of be able to pair workers together to give some of that peer support or establish a buddy system. One of the strategies that I really like was just, as simple as sharing one thing that makes you smile during a shift. So because often at the end of the shift, we're there thinking about all the things that went wrong or all the things we didn't do right. But if we can stop and reframe that negative thought to what's something that went well on my shift today, or what's something that made me smile. Again, being able to do this can help to mitigate the symptoms of anxiety and depression. Solomon did a bit of a blog and offered the ABCDEs of Self-Care, and I've incorporated a lot of the different strategies into this because I love the acronym. And so when we think about A, it's really about. Stay informed about the pandemic. We know it's changing and we know that there's misinformation out there. So it's really important about choosing trusted sources of media and choose wisely. And then also limit your media exposure. So is it that you're going to check and listen to the news in the morning and then maybe later on in the day? We want to avoid having, the CNN on the loop all the time. Making sure that lots of evidence that media has the ability to either increase anxiety, insomnia, and depression, or help to calm it down. And sometimes it is media's intent to cause distress in people. So making sure that you're being mindful of that and that you're being really reflective in terms of, after consuming media, how are you left feeling? Maybe looking back to that mental health continuum. When we think of B, it's really about the body. And one thing Solomon didn't include, but is really breathing. We don't want to negate the impact that deep breathing can have on ourselves. Taking a deep breath in and of itself can be very calming. We know that breathing can help to reduce the stress hormone in the body. It can help to reduce the effects of the fight, flight, fright response, and that our breath is always with us. So it's something we can always rely on. In terms of looking after your body, really making sure that you're exercising. I know I spend much of my days now sitting, and so really forcing myself to get out for that walk. Making sure that we have good sleep hygiene and that we are getting sleep. Often we have so much on our plate that we might be negating to get good sleep. And so that's really important. And as well, making sure that we're eating well. So good nutrition. C stands for connect. And so what we really want to do is we really want to connect with other people. Some of the information is, and you might have noticed the change in terminology, is that we're physically distancing. We're not socially distancing. We started out talking socially distancing. We need to physically distance from one another, but we need to stay socially connected. When we think about that connection, we want to think about connecting with ourselves, which might mean taking that deep breath and checking in where you are on the mental health continuum, but also connecting with the people in your lives that really add positivity. So is that connecting via Skype? Is that FaceTiming? And really making sure that we are, especially with seniors, a text isn't the same as being able to see someone in person. Thank goodness for Zoom during COVID-19, because that allows me to see some of you on a somewhat regular basis. D stands for develop. And so it's really about being creative about finding new ways to do things. We've done this in terms of even doing the work that we do. But what we have also seen is that people are starting to kind of tap into that creative lens. They're starting to sew or do art or knit. Some people are starting to sing. And so we know that stress can cause post-traumatic stress disorder in different people, but being creative has shown to, and learning something new has shown to contribute to post-traumatic growth, which actually helps build our resiliency. And we need that resiliency right now as we move through the pandemic. And finally, E stands for emotions. And so I think what's really important is that we all experience emotions. Emotions are normal. Healthcare workers, we're not immune to emotions. We're human too. And so in a pandemic, these emotions can be more vivid, and they can lead to irritability, insomnia, depression, and anxiety, and increased distress. And so we really we deserve emotional support, whether we are, seeking that out informally and just talking to a trusted colleague or friend, or whether we're seeking more formal help. But we really are all in this together, and to think that we might be able to go through the work that we're doing without those emotions is unrealistic. We have spent the PRCs a lot of time breathing, and some of you may have seen this before, but there are lots of activities, apps, and exercises out there for breathing. We're not going to practice this today just for the sake of time, but this is something that was developed by a social worker with the TEND Academy. And as I said, breathing is used in many sessions. There's lots of literature on it, and it can really help to reduce stress. It can help to stop those racing thoughts, and our breath is always with us. So using breathing exercises helps to promote mindfulness, meditation. The old adage, or my mother used to tell me, to take a deep breath, it really does calm us down. Some people, and a lot of evidence has talked about using yoga, singing, and just breathing apps in general can help to mitigate some of this stress. Just before we get started, I want to talk about a couple of resources, and then I see that the chat box is lighting up, and I hope people are sharing some different things. But at the beginning, I asked, how many people know of resources that are available to them? And I think it's really important to know that there are resources to access. Some of it is, if you're finding yourself in that mild to moderate, that might be normal for you. If you are experiencing, severe or extreme distress, it's really important to seek help. We know that physical health is important, as is mental health. Some of the resources that are available to access, and even when we've been talking to teams, people don't know who to go to. So being mindful that you can reach out to your family physician or your family health team. Many family health teams have counselors or social workers involved with them. Nurses, nurse practitioners, doctors may be able to provide some of that mental health support or counseling, or they can refer you to resources that are available. Many of us have access to an employee assistance program or an EAP program. And if you haven't accessed it, but you think you might have it, then look into it, because really there is opportunity for counseling, one-to-one counseling. But I know I looked into our EAP, and they're offering newsletters and just written strategies to help healthcare workers during this time. Some people may have access to that. I think also it's really important that there's lots of apps available. And so I didn't pull a specific app. If you have different apps that you're using with your clients or that you're using personally, feel free to add them to the chat box. We know that there's the Calm app, lots of apps to really focus on mindfulness and meditation. And there's lots of research for that. CBT has been proven to be very helpful for this. And it might be formal CPT that you're doing with a counselor, but we can take cognitive behavioral approaches on our own. And some of that might be like you're talking about, changing the way we're thinking through behaviors, thoughts, and emotions. So it might be trying to stop those negative thoughts and see the positive. It might be starting to do different behaviors, going for a walk, taking 3 minutes to do a mindfulness exercise, doing yoga. And I don't want to negate the value of informal supports or friends, because a lot of the research, that's who people are turning to. And what the research is saying is that healthcare workers don't have a lot of time. So really supporting one another and supporting the team. I think what's really important and what I want to bring to your attention is that there is a program that is available. And so if you don't have EAP or you don't want to access any of those other resources, Waypoint does have a program that is called COVID Frontline Wellness, and it connects healthcare and frontline workers with first responders with supports to access services to help them to enhance their resilience during these stressful times. It's a confidential service. It's free, self-referral. You don't need a doctor. And so we've put the link there, and I'm going to ask Debbie to put the link in the chat box as well. But as you can see from this, this is the most recent flyer. It has been offered across Ontario for first responders. So anybody who's working on their front line is able to access this, and it is a confidential program. So I'd encourage you to reach out. 5 hospitals in Ontario, including Waypoint, are partnering on this. So that's what I had to offer for today, and I'm going to open it up. I've seen the chat box, and I'm just going to refer to, I think Debbie was monitoring that, if there is any comments or thoughts. And Debbie, if you're speaking, I think you're muted.
I haven't spoken yet.
Okay.
No specific questions, lots of comments about apathy and feeling a little bit overwhelmed. A few comments about deep breathing really, really helps, and people feeling so much better when they deep breathe. Wendat also has from Zena an EAP, and if any of our employees would like the link, please let Zena know. They have some amazing resources available as well.
Great. Thank you. And I encourage you, it's always a fine line between trying to promote one app over another app, but lots of people, we are connected. And so being able to use that can be quite helpful. I'm wondering, for those that are on the line today or on the call, what positive strategies have you seen used in your workplace? Or have you, I know with the BSS team, the PRCs, we've started having coffee breaks and just that opportunity to come together within the workday to support one another.
The Calm app and the Down Dog app for yoga are a couple of great suggestions. And there's a breathe function on the Apple Watches that can support you to when your heart rate is going up, your respirations are going up, to just calm for a few minutes and just take a breath.
Great.
I was excited the other day, Kim. I was excited. I went with my family. I met with my family, and we put on our masks, my sister and I, and we went to Canadian Tire. It was an experience of shopping that I haven't had in months. And I have to tell you, I went in the store with absolutely nothing I needed and came out spending $220. But I have to tell you, I told her when I went in, this is awesome. And we shared shopping. And it's, sometimes it's just getting back to a normal thing that makes you feel better.
Yes. And I appreciate that in terms of that ambiguous loss, that loss of just being able to go shopping. And I think we need to think about, and what the research really is showing too, is that we don't need to make big, huge changes, but let's just pick 1 or 2 things and let's think about focusing on that. And I think being in Ontario right now, we need to be mindful that winter is coming. And so what is 1 or 2 things you can do for your own mental health or looking after your team or your family as we kind of move into the winter months, and knowing that the situation with COVID is evolving.
So Blair McMillan's put an app down here too, myicbt.com, and it's free.
CBT in Ontario. So thank you, Blair. That's amazing. Amber commented about things simple as shopping is now stressful, and it is. I know I have somebody go out and do shopping for me. I don't usually go out shopping. So for me, the going into Canadian Tire was a big deal because I don't even go to the grocery store anymore. It is a stressful situation, and yeah.
And I think some of that, because that resonates with me, Amber, some of the literature in terms of trying to take those negative thoughts and put them positive, especially if we have anxiety, the way we can target that cognition is that, instead of worrying, does this have virus all over it? Has other people touched it? Kind of reassuring ourselves, what have I done? What actions have I taken to ensure and to be safe? So I am wearing a mask. I am using hand sanitizer. I do have the COVID app. And so I can share with you myself that I get into those kind of that negative thinking, but just knowing that we're doing actions to follow public health guideline can help to bring that anxiety down. And
so some of the other recommendations that I think are neat are board games and ping pong and activities with the family. I know I recently took a course, and it's a free course on Coursera. I'm going to put it on the link, and it's managing your mental health during COVID-19, and it's presented through the U of T and a professor of psychology. And one of the things he really said was karaoke as a family, because you're getting, he called it the mojo, the best mojo that you can get. So the things that were really, really key for handling personal stress was singing, laughing. And so any comedy, anything to make you laugh, laughter was the best medicine, singing and dancing, and spending really engaged social time. And that engagement could be over something as simple as a telephone, like the old days. So it's finding all of that creativity, doing something new, and looking at that. So I'm going to put that link on here as well. If anybody's interested in the course, it is free. If you don't care if you get a certificate, if you have a certificate, I think it's $65, but I found weeks 1, it's a 4-week course. I found weeks 1 and 2 amazing. Really did a really good job on that course.
So great. And I love the sharing. I think that is the number one thing. Let's tap into our social support. Let's tap into our work networks and start sharing what we're finding that we're doing, because that can help to, one, share individual strategies that we can maybe think that we can adopt. Every strategy isn't for every single person, so you have to find one that works for you. But then think about as a team, and I think it's really important, how can we promote psychological safety in the workplace without adding to workload? And sometimes it is about sharing a laugh, or the impromptu dance parties that take place on dementia care units, or those sorts of things. So thank you everybody for your sharing. I'm going to pass it, I think, back over to Allison.
Wonderful. Thank you, Kim, so much for this presentation. It's absolutely resonated with myself, and I know the team as well. And also, I'd like to say a big thank you to the participants for all the amazing things that you've added into the chat box. I know this has been a very difficult, did we say 9 months? And as Kim has highlighted, we are all in this together, and so we are supporting you. I wanted to bring your attention to the fact that our next practice short will be on December 11th, and we will be looking more specifically at the North Simcoe Muskoka Specialized Geriatric Services program's response to COVID-19 and how we've morphed ourselves a bit over the last 9 months. As I mentioned, this practice short will be recorded and will live on the North Simcoe Muskoka Specialized Geriatric Services website. And if you missed any of it or would like to point anybody to it, please feel free to do so. It is located under the monthly education section of the education tab, where all of our pre-recorded practice shorts live as well. So we look forward to seeing you all again on December 11th at 8:30 in the morning. Have a wonderful month.